All right. Our numbers are slowly crawling up, so I wanted to just wait a few moments while folks are getting logged on. As a reminder, before we dive in, this meeting is being recorded, and we will be capturing notes and sending those out. Also, we do have live captioning and ASL today. So if there are any issues or questions about that, please put a note in the chat or in the Q&A box so that we can work through any technical issues. And I believe we've got a poll that we're going to ask folks to fill out. Desiree, can you put the poll up? Great. Just looking to be able to have a sense of where everybody is located across the state. And the second question, getting a sense of what your favorite winter activity is, a multiple choice selection. You can type in your answer or click the I hate winter. Wonderful, wonderful. Well, we'll go ahead and get started. Again, my name is Rebecca Jones-Gaston, and I am the Child Welfare Director here at Oregon's Department of Human Services, and I use she, her pronouns. And it is my pleasure to be here with you today. I haven't been able to be on the last couple of chats, so I was excited to be back here, although I am not quite ready for winter. My house is superheated, thankfully, and I'm wearing summer clothes. I'm holding on to warm weather. We have here today, along with me, Lacey Andreessen, Alicia Cox, and Tim Gillette, and we'll have some guests a little bit later joining us as well. So I wanted to give everybody an update. First of all, April's not with us today. She is on her way back from a well-deserved vacation. And I can give you a hint of where she's coming back from by just saying bonjour. But some of you may be surprised to see my face still on these chats. My transition to the federal role that I was nominated for is just still in a waiting pattern for the Senate to vote. There is some anticipation that it's going to happen at some point this month before the end of the year, but we will continue to keep you updated. And truth be told, I'm actually not sad that it's taken so long. It's given me a whole nother year to actually be here and engage in this work with all of you. And, you know, I like Oregon. And so it hasn't been painful or sad for me to still be doing this important work. We had an election since the last time we talked. So we've got a Governor-elect Kotek. She will take office on January 9th. And so lots of anticipation of what that means and where we're going. And there are some things that we won't know until she lands in the office officially. But we do know that there are a few key priorities that Governor-elect Kotek has identified. One is around homelessness and housing stability. Another is around mental health and addiction services. And yet another is around bridging divisions across the state, and the divides that have, I think, sometimes been felt over the last few years. Well, we know that homelessness and housing stability and mental health and addiction services are absolutely things that impact the communities that we're serving, and looking forward to finding ways to continue to build capacity in this state so that that is available for families and young adults that we're serving. Because, as a reminder for winter around homelessness, it's a brutal experience to not have housing stability or to be houseless. And mental health and behavioral health services are so critical to all of us. And when you're also working through other challenges such as poverty or other issues, it just gets really complex to be able to have your needs met and have the resources and supports that you need. And so looking forward to being able to have those things prioritized as key issues in our department, but also within child welfare. I want to give just a couple of highlights. I'm not going to go into detail, but we'll just, kind of sprinkle like snowflakes into some highlights around our legislative concepts and our policy option packages that are coming up. We have a number of legislative concepts. So those are things that are being proposed for law. We have an ask for staffing connected to our child safety teams, as well as family preservation. And within our child safety team ask is connected the work of our ART teams, so our addiction recovery teams, and the supports that we have available across the state to help support those that are struggling with substance use disorder. We have some asks to clear some double fills, and that's a technical term we can talk about later if you want. But around our fatality prevention and review team, it was one of the recommendations that came out of the work we did with A&M. And we haven't yet been able to get those positions fulfilled for a variety of reasons, including the legislature, going home to sit in front of their fires without taking a vote back in 2020. We are looking to expand our focus services to be able to serve children outside of foster care. So as part of our family preservation and stability work. I also have 3 dogs at home with me today, and they may want to also chime in. So you'll hear them. They're supposed to be on timeout right now. We are looking to try and increase the rates of reimbursement for our resource families. They haven't been increased for quite some time. And getting some budget supplements for what we used to receive from child support payments and from some of the Social Security benefits, because we've made some policy decisions that have been supported at the federal level to not pursue child support payments from families that are involved with child welfare, so that they can use the resources that they have, oftentimes limited, to get ready for reunification and be able to work in partnership there. One thing I do want to just highlight, and we'll have our latest monthly governor's report coming out soon, that shares that we've had some improvement in our hiring, and some of that has to do with the pace of hiring, but also the number of new staff coming on board. It continues to exceed those that are departing child welfare. but we're also partnering with our human resources team to actually diversify our recruitment strategies so that we are reaching out to more diverse communities, but also in different sort of mediums and ways so that we can continue to attract people to come to work for the department and secretly, specifically work for child welfare. I'm a little biased, I admit. For the rest of the conversation today, we're going to give you some updates around some of the programs and initiatives and some highlights. But I also just want to remind you that you can put your questions in the Q&A bar at the bottom, and we will respond in writing or try and slide them in into our conversation this morning, and just encourage you to ask questions. We enjoy these, hoping that you enjoy them and find them helpful. And I see a question now that says, are we doing anything to recruit current DHS employees to other roles? That's a great question. I think there are a couple of things happening is as roles come available across the organization, those announcements come out by way of email. I think there's also the opportunity of rotation positions to test out whether or not you're interested in a new opportunity or to develop and learn some new skills. So we'll continue to talk through that. But if there's ideas, send them our way also of what can we do to continue to just create opportunities for recruiting people to come work for us and with us, but also opportunities to grow and develop within the organization. I'm going to stop talking. And I'm going to hand it over to Lacey for some updates. Again, put your questions in the Q&A, and we look forward to having the conversation with you today.
Thanks, Rebecca. Good morning, you all. It's great to be with you. My name is Lacey Anderson. My pronouns are she, her, and hers, and I'm the Deputy Director for the department. My role is aligning program and practice across the state. It's great to be with you today. I'm going to echo quickly what Rebecca just said and what Alicia put in the chat. Because you all are active in the chat today, which is so fun, I'm glad to see. Make sure to put questions that you would like us to either respond to today or get back to you in writing in the Q&A section so we can keep them separate. I get to start with some really good news this morning. It is the first of the month, and like other firsts of the month, can you, I just saw these comments. Can you all hear me? Yeah, okay. I get data, and the data that I had in my inbox this morning was around family reports, case plans. And for the month of September in Oregon, for children who had to enter foster care, I'm so distracted by the comments that you can hear me, I'm so sorry. The number of parents who had timely case plans was 64.8% of the kids who entered care. It's the highest that we've gotten so far, and we're very close to our first benchmark of 70%. So kudos to you all, because while we set the data goal, the reasoning behind it is that when we have to intervene so invasively that we have to separate children from their parents, parents need and deserve a document that tells them what they need to do to get their kids back. So please keep focusing on that work. We're getting better every month, and it's so great to see the improvement. I really appreciate it. I wanted to give you a couple of quick updates about the implementation of family preservation. What we're seeing so far in the 3 demonstration sites is that the number of families served in home continues to increase. We're also really learning, leaning, and understanding better the impact of true partnership between self-sufficiency and child welfare in engaging families, and also focusing specifically on how concrete supports alongside services are really helping us to be able to serve families in home without having to separate them for the purpose of foster care. A special shout out to Klamath County. In that demonstration site over the last 8 months, the number of families that we're serving in home is higher than the number of families that need to be separated for foster care, which is exactly the direction that we want to be moving. A couple pieces of data for you. The average length of an assessment for a family who's being served in family preservation is 42 days, which is awesome because we have up to 60 days. So that means we're getting those safety assessments done in a timely way. And then we also see that the vast majority of families have some prior experience with our system. And so really doing some analysis and looking at what could we have done the first time that we were in contact with those families to have prevented them coming back to us again. And then moving forward, we're going to continue to focus on the community partnerships that are being built, as well as where we can expand services utilizing Family First in the counties where they are, and where the 3 demonstration sites are. And then we'll be looking by mid next year to identify the next set of sites where we'll be expanding. OrCids mobile app is out and functioning and ready for you to use. Please use that tool. While right now, what you can utilize it for is entering case notes and seeing the participants on your cases. We will continue to expand what's possible with that tool, and your utilization and your feedback is key for us in knowing what other things we should be doing, how to tweak it. So you've got it now, use it and let us know how it's working. Special congratulations this year for our 2 Tom Moen Award winners. Amanda Catchpole is from District 1, Alexandra Ronning from District 10. Thank you for your service, your time, and your engagement with families. There's also an email that lists a whole bunch of other honorable mentions, so make sure that you see that. A plea from me. When you are moving children, have to remove children, or are returning children home, please put their items in duffel bags. We have a really important community partner who has provided us as many duffel bags as we could possibly need. They are out and in your offices now. So please, please know where they are and use them absolutely whenever possible. I know there's circumstances and times where it's not possible, but you have them in your offices, put them in your go cars, have them ready. Because we want to honor the rights and respects of children and put their belongings in a nice bag that they have. And we have the resource to do that. So you'll be seeing an information transmittal. We've updated procedure around that and are just really asking you to know where they are, know how many of them that you have available to you, and utilize them when you're interacting with children.
And we would love to see pictures of you with them, not necessarily with the children or the young people, but really just showing that we've got these bags available and that we're utilizing them.
Yes, thank you, Rebecca. Last update for me, and then I'm going to hand it over to Alicia. We are in the midst of planning for the end of the emergency that has been COVID. That's going to impact some of the services and supports that families that you serve are getting from self-sufficiency. We're working through some communication strategies, and we'll get more information out to you. Janelle's going to drop a link in the chat where you can read more about what the impacts are. But I'd like for you, please, as you're interacting with your families, to be talking with resource parents, as well as parents who have children that we're serving in home, about the impact of the end of the emergency and how that may potentially impact the services that they're getting. And again, take a look at the link and you can read through and get some more information. With that, I'm going to hand it over to Alicia.
Thank you, Lacey. Hi, everyone. Alicia Cox, she, her pronouns, Deputy Chief of Strategy and Innovation. And of course, I always bring you a flurry of updates on data, research, continuous quality improvement. So very excited to give you a brief overview of what's been happening in the last few months. As you know, last year, or maybe you don't know, we streamlined our data request process with OLRE. They had a form in which you filled out for your data request, whether it's a dashboard, a report, an edit to report, a poll of data, and you submitted that form through an email. Now they've updated it. It's now electronic. It's on the share site. Janelle will drop the link so that you have the direct link to go and request your data and request. If you're finding that you're having a question about your data, you're not sure about what question you're trying to answer, or you're getting a barrier as in like you're not getting a response or is a delay in timing to get to that report or data request, let's talk and chat, because I know we're trying to not just improve the process and be more efficient, but identify some of the challenges that we're experiencing since it's been rolled out since last June. The federal performance measure, which is nearly a year old, our anniversary is coming up in the cold month of December. And as maybe you're trudging along through the snow or in some of the other precipitation we might experience in the state of Oregon, and you're thinking about what our federal performance measures may look like, you can go to the website and take a look at the most recently updated, which was about 2 weeks ago on November 15th. And this has our Children and Family Services review data, our CFSR measures. It has it as an overall state and where we stand. It also has the opportunity to look at your particular district. So if you have not taken a look at it, I highly encourage you to look at it. We are including it and utilizing it as part of our continuous quality improvement efforts. So if you are in one of the districts, D6, D12, D1, as we head there next week for our kickoff meeting, take a look at it to see where you are right now so you can become familiar with our current state and our data. Another CQI update that is, I think, pretty exciting is that Jennifer Ricks, the CQI manager, was able to recruit and put out offers for all 5 OPA 2 continual quality improvement analysts, such a mouthful. And the tribal relations CQI analyst will be posting soon. I know she has a conversation with a recruiter. It's a position that will be strengthening the relationships with the Oregon tribes, also build out the data capacity and better understand their data needs and data opportunities improvements. And it's going to be a critical position. So very exciting for that position to be soon and ready for recruitment. D12 and D6 are fully in their continuous quality improvement cycles. They have identified their measurements in which they're hoping to improve. They have identified the action steps and the practice measures, things that are improving in the day-to-day practice to really to improve the outcomes on our federal performance. So this is a critical component in our continuous quality improvement, is figuring out what are those bite-sized changes in our practice that we can measure to see the long-term outcomes in our federal performance measures, our CFSR measures. So they're working, D6 is working on their recurrence of maltreatment, and then D12 is working on permanency in 13 to 24 months. So very exciting that they're deeply in their strategy plans. And then of course, I mentioned before, D1 will have their kickoff meeting next week. Don't have any other updates, just wanted to keep it brief so we can get to the FAQ section of our time together. But again, if you have any questions regarding research, data, continuous quality improvement, or any of the other things that might be kind of like tickling around in your brain, or as you're sitting around a warm fire thinking and contemplating about the improvements in our work, send me a message and I'll get some time on the calendar. Thank you so much, and I'll pass it over to Tim.
Thank you, Alicia. Hi, everyone. I'm Tim Gillette. I use he, him pronouns, and I'm the Chief Operations Manager for the Child Welfare and Self-Sufficiency programs. Just a quick blurb today about safety, employee safety. This is a conversation that we hear come up on a pretty regular basis. So we want to make sure that we acknowledge that this is something that we are having conversations about on a regular basis. We're communicating with our facilities teams, our Office of Health, Safety, and Employee Wellbeing, and a lot of these conversations are being led by our Chief Administrator's office. We want to make sure that you all know that we hear you and your concerns. We're working with your local leadership as they bring concerns to us, and trying to find the right solutions to make sure that we're improving employee safety. We've done things like add fencing, lighting in parking lots, cameras, both external and internal, as well as a few other things that we've done to just improve the safety of our buildings. The other thing that we know that we need to be having more conversations about and continue to improve is employee safety when we're not in the offices. And so those are conversations that we continue to have as well, to try and find the best solution to help improve employee safety. So we're excited to continue those conversations and to hear more from you and from your leadership. And we'll be doing our best to address those as concerns come up. And that's it for me, but luckily we have some special guests today. I want to kick it over to Heather Cawley, who's going to talk about, from our Workforce Development, Equity, and Training team. Heather?
Hello, everyone. Thank you so much for this opportunity. I am Heather Colley. I use she, her pronouns, and I'm the Child Welfare ADA coordinator, and I do other equity projects. Kira will be joining us hopefully in the next 30 seconds. We just wanted to take any opportunity on any platform that we can and have to connect with you all. And yes, I am wearing my beaver sweater for everybody to see. So what we wanted to do was make sure that we just, again, introduce ourselves and talk a little bit about some of the things that we're doing. And one of the things that I've been spending a lot of time over the last year is doing a lot of case consultation. And for those of you I've been able to connect with, I hope it's been very helpful and valuable to you, because I have enjoyed the conversations and learning about lots of things that people are doing and some of the great work that is happening out there. And then just offering some additional resources and ideas along the way. So we will share our equity page too in the chat, so that you all know that we are available to do ADA consultations and other equity consultations as well. So we want to make sure that you all know that if you have a youth on your caseload who identifies as transgender, like, reach out to us, connect with us. How can you advocate for that youth, now? And we want to, reduce harm and make sure that we're doing all the right things that we can do to support those individuals. And it's better to just connect with us and have a conversation about some, resources and other things that are out there and available. So Kira just joined. I know we have limited time, but I appreciate any time that we have. Thank you so much. And I'm going to hand it off to Kira right now to introduce themselves.
Thanks, Heather. Hi, everyone. I am Kira Hunt. I use they, them pronouns. I am Child Welfare's cross-program equity coordinator. So I'm excited to be here. We just really wanted to stop by and talk a little bit about the resources that Heather and I have and what the equity team does, because a lot of people haven't heard of us. And so we want to make sure that you have the resources necessary to be able to lead your work equitably and being able to kind of connect with not only the work that you do, the folks that you work with, and the children and families we serve. And so we have some resources that I am going to share, but we are available for consultations if you ever have, a case with questions around racial ethnicity, or a youth with LGBTQ needs, or, some disabilities or language barriers. Heather and I are available to have consultations to kind of connect with you and give you some of those resources to be able to connect about that. And then if we do not have the answers, because we don't always have those, we can creatively problem solve together to figure out what that looks like. Again, like, this equity work is really not useful. We're not sustaining this. We haven't sustained this within the system or structure. And so this is all really new for us. And so there's different ways and different creative options for us to be able to figure out how we can provide the most equitable service to the children and families we serve. And acknowledge all of the diversity that our staff bring, and how we show up to the work too. So I am going to let Heather talk. Did you already say some things? And then I will put in the chat our equity page that you can go on to. There is resources in there. There is a whole equity teams channel. That's where we hang out. There's some cool folks in there where you can chat, and we have presented some, opportunities for people to look at, like, our TikTok learning, right? Like, we got to get creative with how we learn about these things. There's some really cool articles and just a really great community to connect with folks who are also leading this equity work within the agency. So Heather, I will pass that to you, and then I will put that in the chat.
Sure. And, anytime you just have a quick question, you can send us an email. You can say, oh, I saw a presentation. Do you have this resource? We have you covered. Reach out. No question will be ignored, and we will always be available for whatever you need regarding some of these equity conversations. And I just wanted to do a quick shout out for a project that has happened over this last year and is still kind of in the works. We have sensory rooms that have been that are being created in all of your district areas and hopefully all your different branches. And it's been an amazing project to be a part of. I wanted to give recognition to Sean Sullivan from District 6 and SSA and his leadership team for really having a big start to this effort. And I'm going to be sending out an email showing a few pictures of that, of a couple of different spaces and some information. And the sensory rooms, I think, are a huge hit. I know the people that worked on the project learned so much throughout the process. And yes, I have heard some, requests or ideas around staff room. So it is noted, and we will be having conversation with, trauma-informed folks about, what we can do with that. But in the meantime, if the space is open, go into those spaces in your different areas and take a minute to breathe and just, take a moment for yourselves. So thank you so much, everybody, for, inviting us to this space and allowing us time to share, and reach out anytime you need anything. And I'll let Kira say one more thing before we head out.
Because I'm excited. Like I was really ready to be here. If y'all didn't see our email yesterday, the CREAL hijacked one of those all staff reply emails because we listened, we asked, we were like, how do you want us to connect with you? And everyone's like, no emails. But like we figured we were gonna get creative with that. So if you didn't see the email, we have Child Welfare Race Equity Leadership Team. You do need some Dawn soap, absolutely. And so if you need or looking to have a place to like have your voice heard or work on some of this equity work alongside us, we have so many subcommittees that you can participate in, and we would love to have you. So I'm going to put in the chat the application and poll for Child Welfare Race Equity Leadership Team. And again, this is just a space for everyone to be able to connect and work on the work that, we are trying to kind of move along in LGBTQ and disability justice and racial equity, language and communication equity, and am I missing, what's the other one I'm missing? There's one more. Worker safety and well-being. So I'm really excited to be able to share that with y'all, and that we're finally recruiting for that. So please share some space alongside us.
Thank you both so much. And I would just invite you all to utilize these two resources. They're a resource to me, and they carry just a wealth of knowledge around coordinating and collaborating with you about how to best serve children and families. So thank you both. Our next special guest is Alex Palm. Alex is a policy advisor to the executive leadership team, and he's going to talk about some changes to Medicaid that we've received through waiver.
Great. Thank you, Lacey. Hi, Alex Palm. My pronouns are he, him, and his. And as Lacey said, I do some policy work with our partners at the Oregon Health Authority and their coordinated care organizations around our healthcare system and Medicaid delivery plan. I'm going to share just a quick slide. I'm going to try once. If it doesn't work, then I'll just talk. So the Medicaid waiver is really just a tool that Oregon Health Authority has as our Medicaid responsible entity to do things outside of like the normal Medicaid delivery system that states have available to them. And so every 5 years, we have the opportunity through OHA to ask for changes to kind of how they work with families, individuals, and really all Medicaid members. So I pulled out the 3 things that I thought were most relevant to our work with children and families, and both before coming into care and as we try to transition out and back home. So the first one is changes to how enrollment determinations are made, and typically a decision's made and a redetermination is done after a year. What changed and will change starting next month is that children through the age of 6 will just be continuously enrolled. So they shouldn't have Medicaid enrollment change. There might be some situations where that would change that we can, I think will be figured out in the next little bit. I guess what I should say about all this too is this just got approved by the federal government through like a really long negotiation process with OHA. And so these are really all just kind of concepts. And even though some of them are going to be starting sooner, they'll be refined over time. And And then really, hopefully, the goal is that these demonstrate effectiveness over the 5-year period, and then they just remain as part of the way that Medicaid members experience the healthcare system. And the other part I should have said at the front end is that what was really cool and a little bit different this time through the process of designing is there was really good engagement through with both child welfare, self-sufficiency, other ODHS partners, and a lot of our community partners that we share with, healthcare providers and payers. So for children who are ages 6 through 17, the continuous enrollment period will be for 2 years. And this really just is to support the continued coordinated healthcare and continuity for health related services. And so less of a concern about like where coverage is happening, but just making sure that, you know, youngest people have access to healthcare when they need it. The early periodic screening, diagnosis, and treatment, where you'll just hopefully get to learn it as EPSDT, is a benefit that is actually required for states, and Oregon is the last state to be implementing it. And it really is just ensuring that all services that exist are available to youth and are reviewed on a per case basis. Oregon has had, so the change from this is not actually something we put in the waiver, it's something that we removed from previous waivers. So there is this initial push to just get the bare minimum of that available. And really what you should be seeing with this is easier access eventually, but more that the determination of what can be paid for is done on an individual basis and not like some checklist that we're going through. And that would be mostly through your coordinated care organizations. And really, I think what you should be seeing it, and I think this is where we'll, you know, be continuing to work on refinements, is that as you know, pediatricians, behavioral health providers, and those referring for services are doing it, that the array of things that are available are just broader and more tailored to the specific needs of children and youth. And then the one that is really gaining a lot of attention, I think there's a ton of excitement around, is this creation of a eligibility group that's youth with special healthcare needs. And that's just a very broad group of individuals who just have additional challenges besides that need some or can be met with what they're calling social needs or services to meet social determinants of health. And that will include housing, food assistance, climate related needs like heaters, air conditioners, and really other things that we work together to identify, support the overall health and well-being of children, and youth and young adults. And one of the really great parts about the way that this was written is that so most healthcare services are just able to be delivered and paid for the individual who qualifies. This specific one is actually developed or is being designed to be implemented for whole family systems. So if it's a young person and one of the needs for them interacting with our system is lack of housing, then this will allow for the healthcare system through Medicaid payment to pay for housing assistance. And that all of those are going to be built out over the next year. So it's a full year, hopefully, to design. And then in 2024, we'll be hoping to see all of those available. There's just a lot to figure out about what eligibility looks like and how we determine what services should be put in and how much that's going to cost. So the phrasing they use for eligibility that is really going to be helpful for the children and families that we work with is that they put the broad statement that there's an eligibility for this group who get these benefits that are children transitioning in and out of child welfare. And that includes families that we're finding are at risk of entering further engagement with us. And again, a lot of that, like what that means, is going to be figured out in the next year. But it's really supposed to, it's intended to support both prevention of the need for foster care and quicker reunification with families. So there's just a lot of really cool opportunities. There's a lot more in the waiver. These are the ones that I felt like I could get in a short amount of time with you. There's a link at the bottom here, but if you just go to the OHA website and look for the 1115 waiver, there's a lot of really cool resources, some recorded webinars, and always happy to talk about what you should be seeing with this, and if there's questions on like what this actually means with work with your coordinated care organizations. I think those are some of the conversations coming up. So thank you very much. I will take this
Thanks,
down.
Alex. Before we let you off the hook, there's one question that's come in specifically for you, and then we'll move to question and answer time.
Okay.
For this, for the medical program, is coverage going to cover all youth formerly in foster care, no matter which state had jurisdiction? And if you don't know that, you can get us the answer and we'll get it to the person who asked.
Yeah, let me ask that. And if it isn't currently being thought of that way, we will ask that it include that.
Oh, and Lacey, can you ask that question again?
Yes. So the question is the foster youth medical program coverage for those who exit care at age 18 plus going to cover all youth formerly in foster care, no matter which state had jurisdiction?
I mean, and again, this is Rebecca, everyone. My guess is maybe not, because the Medicaid oftentimes is tied to, that's a good question, tied to residents, because it goes by the state foster care. And those, we can dig into that and actually, add that to our frequently asked questions as we learn about all of this. So great question. You stumped the panel.
Thank you, Alex. I appreciate it. You're getting a lot of information, a lot of links today. I just wanted to mention that our executive support will be sending out an email that contains the information that you've heard today. So don't panic if you're not able to get everything down.
Yes. Thank you, Lacey. Again, this is Rebecca, and we'll be sending out the links again, the slide that Alex showed, along with we're putting together a kind of cheat sheet about our legislative concepts and our policy option packages that will have a little bit more detail than certainly what I shared today. And we're going to provide some additional opportunities as the legislative session moves forward around updates and questions and things like that. And there will likely be some opportunity for folks to add some input for us to think about when we have opportunities to testify in front of the various committees. There were a couple of questions that I wanted to answer that were put in the Q&A. And so I'll cue my fellow teammates to be looking in the Q&A to see some of the other questions. And Lacey, I'm guessing you can figure out which ones you're going to answer. So about vacancies, recruitment and retention of workforce. So I'll start with our vacancy rate is, and Tim can correct me if I'm wrong, our vacancy rate around the key kind of case work staff positions, so not just SSS1s, but the other support positions that are critical to serving children and families, we're at about a 13% vacancy rate. And that is higher than where we were a year and a half ago. And it absolutely coincides with this kind of workforce phenomena that's happening around the world. And so it is certainly higher than we want it to be, which is why we are working with HR to come up with some other recruitment strategies. I think there are other venues also for folks to have advocacy with areas that, address kind of pay scales and classifications and those sort of things. And so I encourage folks to be fully active citizens in Oregon and share with your representatives and folks around what your needs are. And we are certainly advocating on behalf of the department and what we see some of the needs are around those issues. The one thing that I'll just call out when we talk about retention of workforce is there are absolutely strategies in the works at the state level for how do we retain staff. It also is something you can contribute to. Because a lot of retention is about the experience that people are having kind of in the day-to-day and in their offices and with their colleagues. And so thinking about local level strategies around recruitment and relationship building is needed in addition to some of those other things that tend to be maybe a little bit more material or those sort of things. Again, I think it's a topic worth a little bit more time than we have this morning. And so why don't we plan to have a larger discussion at our next chat, and we will make sure then that our workforce development team is here, and maybe we'll have some of our HR team join us as well to talk about the strategies that are happening for child welfare, not just and the department. But again, if you have ideas, send them our way. We are open to considering all sorts of things and seeing about what we can do to make ODHS and child welfare a place that folks want to come and work and stay and do this really, 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 really hard work. There was one question in there or a comment in there about the SSAs and visits and the frequency that people are having to help support visits. We are absolutely aware of that, and the SSA position is one of the positions where we've got a higher vacancy rate. And so thinking about, particular strategies around recruiting to get those positions filled will be one piece of the assistance. The other one is I really am encouraging us to, as we're working with our resource families, is engaging them in being able to support visits and have visits happen out in the community so that it isn't just ODHS transporting to and from, but really engaging how are we actually helping our resource families grow their skills in partnering and being a support to visits that can happen at different times than maybe works out for our workforce to support and can support the frequency, because more contact between children and their parent or parents is really important for us to be able to move towards reunification. So again, if there are ideas, thoughts, we don't have it all figured out, but we are open to your ideas and suggestions, and we will continue to share the strategies and things that are happening around recruitment for those key positions. I want to turn it over maybe to Lacey to answer a couple of the things that came up related to temporary lodging.
Yep. Thanks, Rebecca. So let's talk a little bit about temporary lodging. You all are doing just an enormous amount of work to prevent children from entering temporary lodging. On any given day, of all of the children who are staffed, only 25% end up experiencing an episode of TL, and it's a very, very small portion of our larger foster care population that's taking up a huge amount of energy and time. And so, first of all, you have our gratitude for the amount of effort you're putting into the work with children who may need to be placed in temporary lodging. We are working at a local level, at a district level, at a statewide level, at looking at different ways that we can do a couple of things. One is
continue to get you the support that you need when you are in the position that you're supervising a young person in temporary lodging, but also systemically what's not working, that we end up finding ourselves in a place where we have children and young adults who do not have an appropriate placement in it, and then it is reliant on us to care for them. We're working very specifically with the Oregon Health Authority as well as the Office of Developmental Disabilities to expand capacity for children who are eligible for those placements. And then the treatment services team is looking at data and analysis for where do we have VRS facilities, what youth are they successfully serving, and how can we expand their capacity as well. And then in addition, we're deep in conversation right now about expanding contracts with contracted providers who some of you have worked with that come in and assist with meeting the needs of children and young adults who are in temporary lodging. It's a really complicated web of a problem, and we're in it on a day-to-day basis. I think what I'd like for you to take away from this part of the conversation today is Rebecca, April, and I specifically are deeply aware. We're advocating in every space that we can be in, and we're in it with you, and really just are also open to your suggestions about what's worked for you in terms of the young people that you serve and how you avoid temporary lodging. And we want to move those good practices across the state. So gratitude, awareness, and we will continue to do everything we can within our power to help assist. I also want to make one hilarious note. So we have a person on our team named Lee Brown. He very kindly shared his link in the Teams chat that accidentally happened, so folks knew where to go to get here. And now there's a plethora of Lee Browns in the chat and asking questions. So lots of Lee Brown participation today. Thanks for sharing your name and your link, Lee. We appreciate you. One other area where we got, yes, the person who just asked that, you are showing up as Lee Brown. Yes, you can right click on your square. It's a little late now, but you can, and change your name. One other area where we got a lot of questions that I wanted to address quickly is around what we're doing to continue to work on recruiting and retaining a diverse pool of resource parents. And that what we are doing should be a global we, because all 445 of you on this call can help with retention. But specific to recruitment, find your champion, know who they are, know what your efforts are for the data for your local community. That's what those positions are charged with doing, and we've gotten this really great resource. Each of them have a plan, and it's driven by the data that's based on the children that you're serving in your community. So there's always opportunity to be engaged in that. We're continuing to partner with every child and expanding what's capable and possible there. And then once we get them, the most important thing is we retain them, and we all have a piece in what that looks like. So that's kind of the update on what's new with retention and recruitment.
So I want to just make sure that we're able to have a little bit of a wrap up, but we, if we didn't get to the questions in both the Q&A section and the chat, we will absolutely circle back. We'll either add them in the information that we send out, or we will add them in some of our other communication and make note of them for our next conversation together. I think the one thing that I'll say, and this is the frustrating part about someone who, myself, I like to move and change quickly. And, our bureaucracy and our systems don't necessarily want to move as quickly as we want them to move. And so that can be frustrating to those of you who are saying we need change and we need something to be different. And so I just want to acknowledge that frustration, but just ask for your continued fire and commitment to pushing us as we push other places in the various systems that exist. And, just continue to offer up ideas, suggestions, and we'll do a better job of communicating where some of the challenges are in regards to some of the things that are suggested. So for example, I can't just say we want to pay our child welfare workforce a different wage. I wish I could. I cannot. It requires us to work within the state administrative system and the classification system to advocate for that. And that's where your role with your union partners come in, where your role as voters, all those sort of things come in to also make the case. And so that's just an example, and it's frustrating on all fronts. And the most frustration is absolutely felt by you, doing this hard work. And so again, I just ask to not be disheartened, that we are pushing against a very slow moving machine, and it's going to take all of us to push on many of these things. And again, I just appreciate the absolute dedication and care that you bring to work each and every day. I've had some opportunities to hear some really great examples from our parent mentors through our parent advisory council. I've had partners reach out and say, I just want you to know that I see a difference happening. And people coming to the table to partner with us in new and different ways. And so for me, that's promising. And so that's the light and the hope, or the crystal that I'm holding on to. In spite of the places where it's frustrating because things aren't moving as quickly or as fast or in the manner that we want them to. And I know that the work is hard. There are things that are not working well. There are things that we haven't figured out solutions to, and we absolutely need to. And so I just want to express my deep and profound gratitude to each and every one of you for how you show up every day and do this work and make my job the joy that it is. And it lets me get up and feel encouraged. And so just, keep pushing. And we are fighting on your behalf, and hold us accountable for when you feel like we're not. Thank you all. Enjoy all of the winter things that are happening, holidays and time with your families and community. Be safe. I'm not sure if we're going to see snow in the Portland area, but I think there's snow happening in other places. Just thank you all again for being great partners and being great teammates, and fighting on behalf of the children, families, and communities that you're serving. Everybody, just take care.